In the late 1950s, in a quiet wing of Montreal's Royal Victoria Hospital, the Allan Memorial Institute looked like any ordinary psychiatric clinic, promising modern treatment and relief to people struggling with anxiety, depression, and everyday emotional pain. A young parent checks in, expecting talk therapy and medication, reassured by white coats and calm hallways, signing forms full of medical jargon that never truly explain what is about to happen behind those closed doors. Instead of regular therapy, they are wheeled into a dim sleep room, injected with powerful sedatives, and slowly sink into a heavy drugged fog where days and nights begin to blur into one another. Hidden inside the pillow, a speaker clicks on, and a taped voice begins to repeat the same sentences over and over, sometimes soothing, sometimes cruel, like, "Your mother never loved you," echoing thousands of times into their half-conscious mind. Nurses turn the patient, feed them, and change the sheets as if caring for someone in a coma. While the room stays dark, the drugs keep flowing, and the looping messages never stop for weeks, even months. Many patients are also blasted with massive electroconvulsive shocks and given experimental drugs, including LSD, as psychiatrist Dr. Ewen Cameron tries to wipe their personalities in a process he chillingly calls deep patterning. When the sedation finally ends, families rush in with hope, only to find their loved one staring blankly, unable to recognize faces, struggling to speak, or having forgotten how to read, cook, or even use the bathroom. People who once held jobs and raised children must now relearn basic skills like counting money or tying their shoes, while huge pieces of their memories feel scrambled, missing, or replaced by a strange, childlike confusion. Years later, declassified files reveal that Cameron's radical psychic driving was partly funded through a CIA front linked to Project MK-Ultra, a secret Cold War program obsessed with mind control, carried out in a Canadian hospital without real informed consent. Survivors and families launch lawsuits and demand answers, forcing governments and universities to confront that this was not healing but non-consensual human experimentation, proof that even trusted institutions can cross terrifying lines when power, fear, and secrecy go unchecked.